Before we hop into this episode, I have one favor to ask of you. If you've got any kind of information or inspiration from this podcast, it would mean the world to me if you hit the subscribe button. Just like most podcasts out there are more people that watch this show that are not subscribed than that are subscribed. And so if you want to help me get bigger and better guests for this show as we go along, and I hope you do stick along, it would mean the world to me to hit that subscribe button so that we can make it happen. Thank you. And let's get into the interview. Doctor of physical therapy, best-selling author, millions of followers on social media. Like, you are impacting so many people in such an amazing way, and diving into pain science and so many other things. Your book has almost 500 pages in it, but for people to start off, what are like the 2 or 3 things that you wish people would know from that book?
Yeah, I think, one of the big areas of focus for me, the first 5 chapters in the book are on the science of pain. And I
Mhm,
think that's such a huge, so the first 5 chapters are on the science of pain, and then the next 5 chapters are on what is an injury. And I think
mm,
one of the biggest things that I try to educate patients on, whether it's on social media or people actually coming into the clinic, is that pain and injury aren't the same things. Most of us think that when we have pain, we actually have an injury to our body, like we tore a muscle or tore a ligament or hurt our joint or something like that. But while that can happen, like you imagine if you sprain your ankle, if you
mhm,
twist your ankle, that pain usually is associated with a tissue injury, like maybe you stretch the ligaments on your ankle. But there's a lot of pain conditions where isn't actually a tissue injury. Like you could do a MRI or an X-ray and there's nothing there, and the person didn't really have an injury, they just have pain. And I think that's helpful for a lot of people to know, is that if you have pain, it doesn't necessarily mean you have an injury. If you have an injury, you won't necessarily have pain. They're different things. And so while they can go together in many circumstances, I think it's just good for people to know, because most people, when they have pain, they're hunting for something. They're like, what's the
mhm.
injury? What's the thing causing this? And pain is ultimately just this really complex, multifaceted, multidimensional experience. And it is influenced by so many things. You and I were kind of just starting to think about, like your beliefs, your emotional state, your stress levels, how much you've slept, like nutrition, pro-inflammatory diets, alcohol. There's so many things. Most of us think about pain in our physical body as just being something related to, like, maybe exercise and
Mhm.
something very physical or like an injury, but we don't always consider all of these other stressors that can impact our nervous system.
So big. So even just to dive into the nervous system as a whole, most people are unaware of, and I'm still learning about this day after day, of how big of a role it really plays in our life, from environmental factors, things we eat. Most people are eating things that are not whole ingredient foods. So of course they're not going to really jive with you well. There's so many small things. Do you feel like the small things that we don't think about have almost a bigger impact than the things that we do often think for?
Yeah, definitely. I think especially when you get into these kind of pains that don't have a specific, if you haven't had a really specific mechanical injury,
Mhm.
and you just have pain, like say you have low back pain, and say you've just had it for a long time, and especially if it's pain that's been going for more than 3 to 6 months, more than a year, I really think those things that we would think of as sort of like the smaller factors,
Mhm.
those become more and more of the driving factors in the person's pain. Because once you've gotten out past 3 or 6 months, most tissues in the body will heal. So if the person still has pain, you have to be thinking about all of those other things, like their mental health, their stress levels, their nutrition, how much they're just generally moving, like how sedentary are they?
Mhm.
Are they getting enough sleep, and is it high quality sleep? Those things really, at that point, those are arguably, in most cases, especially stress. I think most of the patients I see, when they've had pain that's kind of getting into that chronic, or we'll call it persistent pain, where it's been
Mhm.
there for a long period of time, I often find that there's this kind of foundational, kind of underlying level of like just stress and kind of mental health, kind of worries and anxieties and fear that are going on. And those, I think when you can solve some of that, start kind of solving that issue or just working on it a little bit, the pain starts to change. I think sometimes the pain is just the manifestation of those other, it's like your body, because pain is ultimately there to keep us alive. And
Mhm.
if your nervous system feels threatened, one of the ways it can protect you is to create pain, because pain is a good motivator. It's going to keep you from doing certain things. And but it's not always, like I said before, it's not always an indicator that something's wrong. You might feel the pain, say you feel it in your hip.
Hmm.
It might not mean that there's actually something wrong with your hip, that there's a muscle problem or a tendon problem or a joint
Yeah.
problem. It may just be that that's your system is feeling threatened, and that's where the manifestation of that sort of threatened state is coming out.
Yeah, I'm reading Anxiety RX by Dr. Russell Kennedy right now. And I had him on the show earlier last year, but really diving into his book this year. And he talks a lot about that, where the anxiety that we feel almost isn't so much a part of our thoughts, but more so, where is it? Are you feeling it in your body? And I
Mhm.
find that a lot this year is I'm diving so deeper into the somatic aspect of things. And it
Yeah.
seems like that's where the core of most things are. Say for someone that does have chronic back pain, I would say 95% of people nowadays seemingly has that. How do you find out if it is chronic pain, acute pain? We could dive into the differences between them, but even just knowing that that's where your body is storing pain, or if it's an actual, say, injury from sitting too long or walking too much. Like, how can you figure that out?
Yeah, it is a little bit tricky. There's kind of different characteristics people can look at. I mean, I think the first thing is, did you have an actual injury? Like,
Mm,
can you think of something recently where there was a trauma to your body? Like, if you were in a car accident recently, well, then yeah, you may have strained muscles, you may have a disc injury, you could have a ligament injury somewhere in your spine. So, first, just kind of thinking about, did I actually have a traumatic injury? Did I have a fall? Like, did something, it could have been you picked up something heavier than you're not normally conditioned for, and maybe have a strain or something like that. But a lot of people, don't have a lot of people with chronic back pain, they won't have a mechanism like that. They'll just be
mm,
having pain that, or maybe they did like months ago or years ago, but they
right.
just keep having pain. And so that injury has probably healed. And so then you start thinking about, does the pain, does it have really kind of easy to find on and off triggers? Like, does it still have a very mechanical quality to it, where like if I get into this position, or I perform this movement, I can trigger the pain, and if I stop doing that, it gets better. That can be a nice way. A lot of acute pains will be like that, where they have these clear on and off type
Mhm,
triggers. Um, and another the quality of the pain. So acute pains will usually kind of always hurt in the same spot. A chronic pain will often have sort of vague borders and maybe start to spread. It might move to other areas of your spine. If it was on the left side, maybe it goes to the right side. It can just start to change to where it's not as specific. It's usually less mechanical. So chronic pains are kind of unpredictable for most people, which kind of causes more anxiety and fear. They
right.
don't know what's going to cause it. And so they'll be kind of unpredictable in that way. And then the big one is that time factor. Most acute pains will heal in that 3 to 6 month window. If you look at the International Association for the Study of Pain, which is sort of the main body where we get our definition for pain, it's when, like I say, when you get past that 3 to 6 month window, most tissues in the body will heal. There are some exceptions, because tissue healing has to do with blood supply, and
Mhm,
some tissues have a lower blood supply. So ligaments and cartilage and some of these things take longer to heal. But in most cases, tissues will heal in 3 to 6 months. So if your pain is continuing past that, then you have to start to wonder, you have to start thinking about, is there something going on that's maladaptive in my nervous system, and it's no longer kind of about the state of my tissues?
a question that I find is usually always helpful to ask is, what role am I playing in this? Because a lot of the time, right, like something like that where we've had a pain in our lower back for our entire lives seemingly, it's been such a part of it's almost a part of our identity at this point. It is a part of our identity that if we let go of it, who am I without this back pain? And it feels almost so difficult to let go of that part of ourselves, even if we want to let go of it, but we've known it for so long that, yeah, I just have back pain. Or something for me that's been big in my family, I'd love to know your perspective on it, is headaches, migraines. Like, it is for most of my life, it was a part of my personality to, yeah, I just get headaches all the time, like migraines to the point where I'm not leaving bed kind of thing. How much of a role, and we can dive into the placebo of things, but how much of a role does placebo play in, or in nocebo? We could definitely dive into
Mhm.
both of them. Play in chronic pain, injury, just dealing with that for seemingly most of people's lives.
Yeah, I think it plays a huge role, especially when you talk about situations like that where pain's been around for a longer period of time.
Mhm.
Beliefs just play such a big part of it, both placebo and nocebo. And most people are aware of placebo, where if you believe something's going to help you, it will help you.
Yeah.
But the other side is nocebo, and that impacts a lot of people when they come into the clinic, where they believe something harmful and it ends up causing something harmful in their body. And
Hmm.
so there are all kinds of neat studies out there like this, where of course there are the kind of placebo studies where they tell people like, oh, this pill is going to help you, or this
Right.
intervention. And it's really, it's a placebo type pill. There's nothing to it. It's like a sugar pill. And
Hmm.
they do surgeries like this where they'll tell people, they'll tell people, they'll take two groups and they'll say, one of you is going to have the real surgery and one group's going to have the fake surgery. And so they do this on meniscus surgery as one example. So they take all these people who have meniscus tears on MRI. They have a meniscus on, they do an MRI and they all have a meniscus tear. And so they tell them, you'll either be in the surgical group or you'll be in the kind of sham, they call it a
Hmm.
sham surgery. And so that the people don't know for sure, when you have a meniscus surgery, they'll do it arthroscopically and they put these little portal kind of sites in your knee.
Yeah.
So after surgery, you'll just see these little kind of holes where they went in. And so everyone in the group has those holes put in, but only half of the group have the actual meniscus surgery. And what's interesting is at the end of it, everyone has similar reductions in pain. So that's another placebo example. But yeah, the other side is that nocebo, where if someone tells you something harmful, and a lot of times this unfortunately comes from different types of clinicians, and a lot of times it's unintentional, and we've learned more about this over the years, but certain words, even the word chronic, we try not to use anymore, because, and this kind of alludes to what you were talking about, sometimes this comes up with family history, where you just believe because everyone in your family's had this problem, it's just inevitable that you're going to have this problem. And so chronic kind of falls in that category, where we've seen in the research that they do these studies and ask patients about different words. And chronic usually means to people sort of that they're doomed and they won't
Hmm.
ever get better. And so now we use words like persistent instead, just to kind of speak to pains that tend to hang around and be a little more stubborn. Phrases like wear and tear, like sometimes doctors will say that people like wear and tear, or degenerative, like they'll talk about, you have degenerative disc disease and your discs, they'll say you'll hear like 20-year-olds go in and have an MRI and they'll say, oh, your discs look like that of a 70-year-old. Those things can be really harmful. Like you see that all the time in physical therapy, that someone comes in and they've heard a message like that and they end up having more sensitivity and pain just because of the kind of fear, anxiety, and stress that message causes. So they're huge aspects. They really influence the pain system and how people feel. And a lot of the reason I got started on social media was frustrations around patients coming in and hearing those messages, and me just wanting to kind of push back on them and try to reframe pain for people, just to kind of reframe that whole conversation, because it's hard to see people not get better all the way because of their kind of mindset and beliefs around their pain.
Yeah, I think a belief or mindset people take on too is that once they've been diagnosed, it's kind of like they're reluctant to do anything about it, because once they've been given this, like, this is the problem, then it's kind of like, all right, well, now I know the problem, but I don't really do anything to move it forward, if that makes sense. Like, we almost feel powerless once we've been aware of an injury rather than doing something about it. But even going to the lens of rest, sleep, there's so many things that we have been told are for our benefit, but there's almost too far of in doing so. Do you find that happens a lot in people you work with as well? As like, once you've told them what the whatever it may be is, they're kind of like, okay, well, now it's up to you to figure it out, not me.
Yeah, that definitely comes up. There often is a mentality with people, kind of two parts to that, where when they've found out a diagnosis, sometimes people will feel like, oh, I don't have much power over this. They feel kind of
Yes.
powerless and like they can't really do anything. And so I think the message on that often is, the musculoskeletal system is amazing. Your nervous system, plasticity in your nervous system, the ability of your musculoskeletal system to adapt. You and I were talking a little bit about progressive overload, which
Yeah.
anyone who's performed weightlifting at some point in their lifetime knows how much the body, the muscles and tendons can adapt when you slowly put more weight in the gym. Your body
Hmm.
can really become much stronger. Your bones become more dense. We have research showing your ligaments become thicker, the cartilage, your discs in your spine, the cartilage in your knees, all these things change when they look at studies on weightlifters versus kind of people who don't participate in that. And so I think one of the messages there is if you've had a diagnosis, don't let it stress you out too much because your system really can adapt with the right kind of stress. And so, and some of these injuries actually won't change if you look at them on an MRI. Like an example would be like a meniscus tear.
Mhm.
Meniscus tears, a lot of people who are kind of middle aged have degenerative meniscus tears. And what's interesting about that is that when a person goes through rehab, they'll often get better. Their pain will go away and their function will go back to normal. But if you did a follow up MRI, the meniscus tear is probably still there because it's just one of those tissues that doesn't heal well. So I'm often trying to help patients understand that try not to be too focused on that thing that was found on MRI or X-ray. Don't latch onto that too much because it might not change that much, even though your symptoms will get better and your function will improve. It just the musculoskeletal system is more complex in that way. And so, and a lot of these things actually exist on pain-free people. There's lots of studies where they take asymptomatic people with no pain, and they put them through an MRI, and about half of the population have disc bulges and disc herniations, meniscus tears, labral tears in their hip and shoulder, arthritis. So now we think of a lot of these things as just we just think of them as normal age-related changes. So you have to look at all of that with sort of a grain of salt. If you go have an MRI or an X-ray or some imaging study and a radiologist points something out on there, just don't stress it too much. It's just one piece of the puzzle. I'm always telling people it's just one piece of the puzzle. So I think that's a big aspect of getting a diagnosis. The other part, like you were talking about, sometimes people do have this mentality of I'm going to just go to this practitioner and they're going to fix me. I've got this diagnosis. I'm just going to go in, and they're sort of passive in their mindset. Like, oh, just
Yeah.
I've literally had people come in and just say, I don't really care, just fix me. And it's such the wrong approach because in terms of the body, the things that have the best evidence are exercise and movement, which are active interventions. You have to participate in them. So if you come in with the mindset of someone else is just going to fix me and I'm not going to actively participate, you're probably not going to achieve the same outcomes as the person who's wanting to participate and be engaged. The chiropractor or physical therapist or whoever you're seeing, they can work on you. Like I'll do this sometimes. I'll work on people on the table. Maybe there's ice or heat put on the person. Sometimes in clinics they'll use electrical stimulation. You might go see an acupuncturist. All of those are what are called passive interventions, where it's something being done to you.
Yeah.
And that can help in the beginning, kind of help get out of acute pain. But once you move past that, if we look at the research, you really have to actively participate. And that's where things like mobility exercises and resistance training, strengthening exercises come in. Somebody can't do that to you. You have to do it. And it has the best evidence long term.
Yeah, I feel that's why like acupuncture or getting a chiropractor, stuff like that, like it's passive. It's great to do, but to be reliant on it is destructive because
Yeah.
at the end of the day, going to a chiropractor once a week might help your back a little bit, but over a long period of time, it seems like it goes down in how much it helps you anyways, and you really do have to play more of an active role. One question I love, and this would be a great question to ask for you, is I think we've gotten to a point, hopefully, in the world where cigarettes are looked on in a negative frame. But what would you say is the new version of cigarettes, something that people should probably, the overlooked thing that people probably should be avoiding? The
Hmm.
modern day version, I guess.
Yeah. Yeah. There's a number of these that come up. I mean, honestly, I'd probably say alcohol. And I think
Mm,
people are more and more people. I live in California, and there's just a lot of health conscious people here. So I don't
yeah,
think the rest of the country is always a good is California may be a little bit of an outlier in some ways, but alcohol is just another toxin, and I think it's one that people convince themselves everyone else is drinking and it's a social engagement, but it just there's so many diseases tied to alcohol consumption now, from obviously like liver diseases
yeah,
to the one that I see come up a lot now is Alzheimer's and dementia. That alcohol is one of the modifiable lifestyle factors you can change to reduce your risk of getting Alzheimer's and dementia. So there's just there's so many different conditions. I just and don't get me wrong, like once in a while if I'm on vacation or with friends, it's fun to have a beer or a
yeah,
cocktail or something. But I I just as I've gotten older, I don't think it's worth it that much anymore. It ends up really disrupting your sleep. Sleep is when we heal, our brains clear. Our brain is so interesting. The rest of our body, we have our lymphatic system, which helps to kind of
Mhm.
clean out metabolites and toxins. Our lymphatic system does not travel into our brain, so your brain actually clears a lot of this stuff at night when you sleep. As you sleep, your brain kind of shrinks down, and our blood flow increases through the brain, and it helps to kind of clear out these metabolites and things that build up during the day. And so if you have something like alcohol in your system where it's disrupting your sleep, you're just not getting that same recovery process for your brain. Your musculoskeletal system is the same. It regenerates and heals at night. Actually, we have studies showing that alcohol inhibits protein synthesis. So if you're somebody who's performing resistance training, like I love going to the gym and lifting weights. I'm not real big, but I like to strength train. But alcohol impairs protein synthesis. So you're every time I've had a drink, it actually I kind of think about this. I'm like, man, I went to the gym today and I really put all this effort into strengthening my body, and now I've had alcohol, which is going to impair that process while I'm healing. So I think alcohol is a big one. You hear people talk about this other things like being sedentary, and I think
Mhm.
that's a big consideration too. Is more and more people are sedentary in the world, and it especially when it comes to the musculoskeletal system and the pain system, one of the best things you can do is just to be more active, like just
Yeah.
move more. It doesn't have to be even like really structured intentional exercise. It could just be like vacuuming and sweeping and just moving around your house, like clean, just doing things to just keep your body moving. You know, a lot of these communities in the world where we see people who get to live past 100, these kind of blue
Mhm.
zones where these individuals are studied, a lot of it is that they aren't often incorporating really structured, like I'm going to go to the gym and run for 30 minutes, then I'm going to lift weights.
Yeah.
They're just moving a lot throughout the day. They're just not sedentary. So I think it's something we need to pay attention to and try to get back to. We used to be these hunter gatherers, and now a lot of us are just sitting behind screens.
So you've heard the quote, you are the average of the 5 people you surround yourself most with, right? Well, that's more true than you could possibly imagine. And what if those 5 people were a human lie detector, an FBI negotiator, an ex-CIA spy, a billionaire, and everything in between? Well, that's exactly what I've been able to do with my podcast over these past few years. From starting in my car with no money, no experience, no following, not even a microphone, and now I'm collaborating with some of the most profound individuals in the world. And it's because of two simple things: crafting the perfect pitch so that when the person sees the message, they are open to actually entertaining the opportunity of speaking with you. And number two, finding a way to get that pitch seen to begin with so that you actually can get in that room. And if you want to learn the skills and how I've been able to get the guests that I've been able to get in my show without any kind of audience or experience, the link in the description will be there for Get Your Guest, my course, and how I've been able to collaborate and connect with some profound individuals and show you how you can too. Yeah, yeah, as we're both doing right now.
Exactly.
It's one of those things where I try to, like, I was gonna stand for this podcast, and then I stood up for about 10 minutes, and I was thinking, sitting sounds a lot better than standing for this hour that I'm going to speak with him. But yeah, I think it's when I had Mark Sisson on Primal Kitchen, who sold Primal Kitchen. He's probably the fittest 70-something-year-old I've ever seen in my life by far. And
He's amazing. Yeah.
when I asked him that same question, it was sitting was the thing that was for him, that I think we've got to a point where going to the gym or going on a run is like this. That is the one thing out of my day. But people like him and so many others, it's just a part of their life. And that is just something they enjoy doing. So finding a way to enjoy moving your body more, I think, is one of the most empowering things that we can do. And like you said, I think a lot of people play or take on this. I don't want to take an active participation, be an active participant in my own, you know, getting over an injury, getting better, feeling better. What are some of the subtle things that we can do on a day-to-day basis to play more of an active role in our own health?
Yeah, I mean, I think, yeah, I love what you said before. Sometimes this stuff will feel like homework to people. They're like,
Yeah.
oh, there's these kind of specific exercises this person's recommending. And it doesn't have to be that way. A lot of it is just try to find movement you enjoy.
Hmm.
That's honestly at a base level one of the best things you can do for your overall just health and well-being. As I've been a physical therapist for 17 years now. In the beginning, I'd give people like 6 to 8 exercises, and you slowly realize that most people, that does feel like homework to them. They aren't
Yeah.
really, and a
Yeah.
lot of rehab exercises are kind of boring. And so I think, now I'll give people one or two movements that I think are going to be really specific to their helping their pain and their injury. But a lot of it is like encouraging people just find something you enjoy. If it's yoga or Pilates, or you like walking, or maybe you are the person who likes strength training, or you like pickleball, like just find something to move your body regularly. And and really make that your focus. I think, when you're also thinking about kind of that active participation, it doesn't have to be active in terms of, kind of like a movement or exercise. It can also just be active in terms of you strategically thinking about what are the habits I'm going to change in my life to just create a healthier version of myself. And so just take on, sometimes we have this tendency to think we have to take on all of these things at once, but just pick one thing that you feel like you can really change and start with that. It could be, I'm going to take a multivitamin every day. I'm going to just try to go for a walk each day. I'm going to try to have a better sleep routine. Like, I haven't been great about my sleep routine. I'm going to try to go to bed at this time every night, wake up at this time, and shoot for that 7 to 9 hours. Like, I think if people just, sometimes this can feel overwhelming. There's all of these different factors that go into your health. And so maybe just pick one and start there. There's an organization I used to always hear them talk about when they were helping clients change their health behaviors. They would score how likely someone was to incorporate something on a 0 to 10 scale.
Smart.
And so they'd say 10 out of 10 is, I can do this 100%. This is easy for me to change. And if it scored below a 9, they wouldn't have people start with that. So one of the ones they just say is like, can you take a multivitamin every day? Most people say 10 out of 10, I can do that. It's like, okay,
Right.
well, just start with something like that. Just find something that you feel like, I can start doing this right now. It's the low hanging fruit, and just tackle one thing at a time. And that to me still it falls into that kind of active participation.
Yeah, one of the best habits I've ever developed is habit stacking.
Mm.
So, say if I know I'm going to brush my teeth every single day, so let me add in a multivitamin right before, just so that that is just a part of my daily routine now. It's like, how can you make it easier on yourself? Is a question that I always go back to, because it's right. It's anything that feels like a chore is not going to be sustainable for a long period of time. When I tore my labrum and I had to go to physical therapy, it was just physical therapy every Thursday. That was the only active participation I would do. Right, other than in the morning, I would do some shoulder stretches and stuff like that. But it wasn't long term, and it definitely didn't feel any fun. So, like you said, pickleball, you can burn 1,000 calories doing pickleball for 45 minutes, but instead of running 8 miles, you know what I
Mhm.
mean? So
Mm.
finding something that you can do to make it a little bit more fun, I think, is an amazing, amazing approach. One thing that I think is really, really fascinating is I found this out this year, I want to say, and I think there's another aspect to it as well. But grip strength is one of the biggest predictors of when someone will die. I think foot strength is on there too. I could be wrong.
It's actually quad strength is the other one, like knee
Quad
strength.
strength.
Yeah, your quads. Yeah.
What are there any others that are big predictors that people can think of?
Those are the two biggest that you hear about in the research are quad strength and grip strength. And it's not that those two strength in those two groups is kind of an idea. It gives you kind of an idea of the person's overall strength in their body. It's not like
Right.
sometimes people think, oh, if I have weak grip strength, that means I'm gonna die earlier. It's
Yeah.
more just
Yeah.
sort of it's a correlation type of thing. So, if you imagine those are two really functional muscle groups, and if you're losing strength in those areas, like I say, it can kind of give an idea of like what the person's overall strength is, but they're both extremely important functional groups. Like quad strength is probably, it's like I say, it's studied equally to the same degree as grip strength in the research. And quad strength, you can imagine, I've worked in nursing homes at different points in my career, and you'll see a lot of people in those settings who can't transfer. They can't go from sitting to standing on their own.
Yeah.
And
Yeah.
being able to transfer from a seated position to a standing position is created mostly by your quads and your glutes, your knee extensors and your hip extensors. So if you lose strength in those areas, you start to lose some of your functional independence, and
Mhm.
which means you just can't move as much. Then if you can't move as much, you're more likely to get things like pneumonia and some of these other issues that end up killing people. So it's this correlational kind of thing where if you start to lose strength, ultimately you just move less, and then you're more prone to these other diseases that take you out earlier.
Yeah, I had Aaron Alexander, the line method. You may be aware of his work. When I had him on, he said squatting is one of the best things that you can do, because we used to sit on the ground, and so just
Mm.
getting up from the floor is something that another thing that will do that. Think about like the long term, and I think the grip strength is big, because if you think about picking up a cup, you can't pick up a cup if your grip strength isn't there. And this will lead into something that we were talking about before this. So when I was earlier in my life, couldn't tell you when, I had 6 stitches, 3 pins in my wrist. I still have the scar there. And I got a grip strength thing when I was right after, because my physical therapist told me I should do that. I was in a cast for probably 7 months out of the year, whatever it was. I'm so grateful that I got that grip strength thing, because it makes me think now I'd bring that everywhere I go. My grip strength will never go down. My forearms might not be the biggest, but my grip strength is there. And so, what are the things? How can we? Same thing with my shoulder. I tore my labrum. I was in two different physical therapists because the first one didn't work out. Had surgery, still going through it today. Where there's some days where my shoulder just doesn't feel great. For someone that has got an injury and maybe they don't want to leap into getting surgery automatically, maybe they don't want to go to a physical therapist automatically, what are the best things that they can look out for to determine the next best step for them?
Yeah, a lot of it, when people come into physical therapy, we are essentially looking for physical impairments in the person's body.
Mm,
So, but a lot of this you can kind of learn and look at on yourself with all the online resources that exist these days. Like say you have a shoulder injury, like you're talking about. Well, one of the first things we'd look at in rehab is, does this person have a mobility restriction? Do they have a mobility impairment? So your
mm,
shoulder is a ball and socket joint. It can move in all three planes of motion, right? So you can raise it through flexion. You can raise it overhead through flexion. It can go out to the side through abduction. It can go through internal and external rotation. You can go through and find resources out there. Okay, like what is the normal range of motion for each of these directions, and kind of look at yourself and compare to the other side. Do I seem to have full mobility in this joint? And then you can start thinking about, okay, I know this joint now moves in these different ways. Do I have good strength in all of those planes of motion? This is what kinesiology is, and I taught this for a lot of years. It's kinesiology is the study of human movement, and it's kind of a shame that we all have a body. We all have this same musculoskeletal system, but the education system doesn't really teach us much about human movement in our bodies. And so I really think it's so important for people just to learn some of these basics. If you want to keep your musculoskeletal system healthy, one of the best things you can do is just learn, okay, I've got these major joints.
mhm,
What are the different directions each of my joints move in? What are the different movements that each of my joints do? And then can I incorporate mobility exercises and strengthening exercises for each of those movements? And if I find a restriction somewhere, like maybe I spend a little more time and focus working on that particular like area of mobility or area of strength. For most people, it's actually strength. Most people, it's like they need to just incorporate a little more resistance training. And part of that might be, some of that is what we call motor control. It's like learning to improve the quality of their motion, kind of their coordination, balance,
yeah.
things like that. So there's an aspect of that that comes into kind of strength training. Like you can imagine, you could have somebody do single leg squats or single leg deadlifts. Part of that has a strengthening side, but part of it is being able to balance on one leg and learn to control that leg. So
Mhm.
and that kind of falls, but that falls into that motor control aspect. But a lot of it, I think, for most people, is like they aren't they aren't strengthening their joints in all planes of motion, and maybe they're not strengthening at all. And that to me is one of the places where anybody can start. Like just start learning a little bit about your movement system, and just, try to incorporate some mobility and strengthening exercises that target your joints in all the directions they can move.
Yeah, I think a lot of lifting specifically nowadays is more towards a specific muscle group when it's getting you away from like the foundational lifts that have always been around that moves everything, which is, I think there's upside to both of them, but you're right. I think there's definitely more we should think about that we don't think about for the long term health span of our lifetime. You
And I
said,
totally agree with what you're saying. Like those compound lifts, those
yeah,
multi-joint kind of exercises, that's the best place to start for anyone. Like
for
you
sure.
can overcomplicate all this stuff. Even what I just said there might freak some people out. Like really just have 5 or 6 exercises. Like the squats you said earlier, like squats are a great multi-joint exercise. Deadlifts, like
Mhm.
rowing exercises for your upper body, a pushing exercise like a push-up or a bench press. You could have an overhead like a shoulder press. There's a few different exercises out there, calf raises. Like if you just had like 6 exercises and you did them 3 to 4 times a week and you just did those on repeat, that would be amazing.
Yeah, and I think finding a way to, like, for example, earlier this year, I was working with the trainer and he had me going to the gym and doing a lot of reps. I'll tell you right now, I hate a lot of reps. I'm not a rep guy. I'll do a lot of weight for a short amount of time. Working with a different trainer, that's exactly what we're doing. I don't hate going to the gym. Like, just finding a way to enjoy it a little bit more. You said you alluded to it a little bit earlier of like just making things a habit. Is there any habit that you have developed in your life now that you wish you developed earlier?
Yeah, let's see. That's a great question. Nobody's asked me that. I'm so focused on health habits all the time. Those, luckily, I think you spoke about identity before. I think growing up as an athlete,
Hmm.
health related habits those have always been pretty natural to me. And obviously, a lot of the
Sure.
patients that come in that I see, a lot of the coaching I'm doing is trying to help people kind of figure out how they can make some of these health habits, kind of adopt them into their own identity.
Hmm.
In terms of a habit, maybe that I've I think probably for me as I've gotten older, which is falls into being a health habit, is that I have, I think as I've gotten older, spent more time on trying to kind of slow down and incorporate, whether you want to call it mindfulness or maybe it's a meditation type practice. I think I've always been the type of person that's maybe a little bit wound up. I don't want to say anxious, but I just I tend to be a little bit on kind of the obsessive compulsive, a little neurotic. My mind is kind of always going, which
Yeah.
helps in a lot of ways. I have found ways to channel it in what I do now to where it's helps kind of with my discipline and keeping me consistent in what I'm doing. But I think maybe the negative of it is that if I can sometimes kind of get too wound up in my thoughts and kind of when I was younger, I might not have taken time to just kind of be still and present. I'm always thinking about the future. And
Hmm.
so that's a habit that I've learned. It's so powerful, I think, for anything. Life is stressful. I think there's a lot of us have so much going on, and there's kind of this hustle and grind culture all the time, and you got to be working on something, and everybody's doing this. I need to be doing this. And I think sometimes we forget to kind of stop and slow down and just be present. And that for me is probably the habit that I've worked the most on, has been the most beneficial as probably in the last 5 to 10 years.
Yeah. Yeah, I can sense that from you. I'm a similar, very similar energy. And as entrepreneurs, it makes it almost even more great in the sense for us, creating, freedom, but
Mm.
definitely destructive in the sense of my brain doesn't turn off. No one's telling me to turn off. So I'm just going to stay locked in at all times. And
Yeah.
it can definitely be destructive definitely for our nervous system. I was speaking with, are you aware of Oliver Berkman by chance?
I know his name. I can't think of what his work is, what
Uh,
area.
4,000 Weeks. He wrote one of the best selling books on, I guess, just living how would I frame his work? Uh, Being thoughtful about exactly what you just said, like that low ambient anxiety that a lot of people go through life with, especially people like us, where we feel like our worth is almost attached to what we put out into the world.
Hmm.
Would highly recommend his work. I did a podcast with him on his new book, Meditations for Mortals, this year, and I'm always just so amazed by the way that he frames exactly like the thoughts that go through, probably similar to your brain, definitely mine, and just the way that we go through life because we get consumed by it. It's really easy to. I mean, that's where we find our value in the world. So how else would we find joy or passion, fulfillment, that kind of stuff? Um,
Yeah, I
yeah,
completely agree. It's a thing I always think about, that I am so grateful for the work I have. I'm so grateful for it, but I often think I don't know how I'd ever retire, because I don't
yeah,
know some people that can kind of just like
yeah,
have their days open. My wife is very good about this. She is much more balanced actually, in that she is very good about spending time, like cultivating relationships, doing other things, going hiking with people, having
yeah,
lunch. I don't enjoy that as much. I just want to be working on. I do. It's tricky because I'm so grateful for the work I'm doing, but a lot of my value is attached to the what I create and put out there, and feeling like you want to make an impact in the world. But that can also be destructive if you don't have that balance and all of your worth is kind of tied up in that. And that is something that's always kind of running in my head. So, and just my head running all the time just about what I'm working on. So I think if anyone else is like that, it is so important to be able to kind of um, step back and just spend some time just with yourself and try to slow those thoughts and kind of make some peace with it in a way.
yeah. A quote that I've probably said on this podcast more than people would like to hear is from Tom Bilyeu. It's that all that matters is how you feel about yourself when you're by yourself. It
Mhm.
always goes back to me because it's like we're always trying to do things and be someone that we never think about, well, how do I actually feel about myself when nothing else is going on? Because rarely do we even just sit with ourselves to begin with.
Yep.
And I'm definitely that kind of person that if I'm going to the beach, I'm surfing. I'm not sitting on the beach. I'm not a person that can do that. And
Yep.
not to dive deeper into this, but I think this is a really powerful topic. I think for a lot of people too, especially from the position that you're in. I mean, millions of followers on social media. I think a lot of people think that once they get to an arbitrary number or they impact a certain amount of people, sell a certain amount of books, then that anxiety kind of gets alleviated in a way. Do you feel like it's gotten bigger, smaller? Do you feel like how has your relationship with work and kind of your self-worth, I guess, changed as you've grown on socials over these past few years?
Yeah, it's an interesting thing. I think I, I think for me, one of my demons is validation from other people. And I
Everyone.
had a lot more of that when I got started on social media. Back in 2016, 17, when I started, I cared more about that. And I think
Mhm,
as I've gotten a little older, luckily that part has gotten better that I don't. I think the longer in something and the longer you're just alive, the more kind of confidence you have just in who you are. And you just kind of feel comfortable with the person that you are. So I don't think I feel grateful that I don't need quite as much of that validation anymore. I just enjoy doing the work to do the work because I know it can help people.
mhm,
But I think there is a little bit, as things grow, there is a little bit of anxiety around kind of this hamster wheel effect that some people talk about, where now you've created this degree of momentum and
mhm. Who are you to stop?
you, yeah, you don't want to stop because it it's gotten to that kind of level of success and it's helping people and there's kind of expectations around that and you feel like you'd really be maybe kind of missing out on an opportunity. It'd
Mhm.
be silly of you not to take advantage of it when you have that kind of momentum there. So, I it's something I sometimes think about, like, what would be my exit strategy someday? When would that be? What would it look like? Because you don't really, most people aren't doing something forever. So
Yeah.
it's hard for me to imagine, I'm 42 now. I think I have a lot of years left creating content and putting kind of, talking about these topics and helping people with them. But it is, it's another part where I have to slow my brain down sometimes because you can get to feeling a little anxious about um, just kind of keeping up with everything, like
Mhm.
managing things on all these different platforms, creating content in all these different ways, and doing it at the frequency that's necessary to stay kind of up in the algorithm. I hear sometimes I think for me is I just have to think about it. If I think about it on too big of a scale, too far out in the future, it will make me anxious. But if I
Yeah.
just think about it as what do I need to do right now today,
Mhm.
that's the thing that's helpful for me. And then it allows me to just be consistent and keep going each day. Like, what am I working on for today? What's going to be coming up tomorrow? And just, I don't really zoom back more than that because if I do, then it will make me feel a little anxious.
I'm with you. I'm with you big time. I've never been much of a planner because it just gets me out of taking the action of today. And if
Yep.
I can't take the action today and I'm thinking about what I need to do for this month, my brain just falls into pieces. I mean, there's a lot of days where I feel I should just drop everything and just get off social media entirely. And then there's other days where I'm thinking, man, like I could post 10 videos today. I could have 100 podcasts go out this month. Like that wrestling, I think a lot of people definitely, especially like you said, the more people pay attention to you, the more you feed into doing it. I often say that success is similar to money, where if you have a little bit of it, you're going to be anxious of not making it, and then when you have a lot of it, you're going to be anxious of losing it. And so you're in the kind of in
Mhm.
the position of like, well,
Yep.
man, like I have all this momentum, I have all these people following me, paying attention to me, like actually admiring my work and paying attention to it. Who am I? I asked for this, now I got it. I'm going to let go of it. Like
Mhm.
that's a really I don't think a lot of people put that into perspective, man, because a lot of people think that once you get to that position, problems go away, but the reality of it
Mm.
is problems just replace problems.
Yep.
And I
Yep.
think you just need to figure out problems you actually want to solve and deal with, which is a
It's so
difficult thing.
true. Yeah, there's always problems, and it's like I've heard people say it's like you're just looking in life to be solving better problems.
Yeah.
It's like there's just I think even when I think as humans, to some degree, we are wired to look for problems. You
Yeah,
hear this like the hunter gatherer, like that's what helped us survive is looking for dangerous things. And so even when life is like amazing, like we are still going to look for problems. I love Mark Manson's book, The Subtle Art of Not
yeah,
Giving an
me too.
F. Like that book, because sometimes I think for a lot of us, we can just start to look for problems and care too much about them. And no matter where you're at in life, we're going to have a tendency to do this. I think it's what kept us alive for thousands of years. So, yeah, it's just sometimes it's just kind of about reframing things, kind of taking a step back. I'm very similar to you in that I don't plan way ahead. I am very spontaneous and impulsive, which bothers some people. Definitely some of our friends tell Kirsten,
Yeah.
my wife, that like, how are you married to him? It seems so crazy, but that's how I thrive and function, and it keeps me. I think it keeps for me. It's helpful in terms of my mental health. Just kind of focusing on like, what do I need to do right now? This is the thing that feels right, and that's what's so great about entrepreneurship, right? Because I can't work for other people. I being able to have my own schedule, make my own decisions, and do things when I want to is so important to me. The freedom and autonomy that comes with
Mhm.
that. I've tried working for other people, and it just doesn't work for my personality. So
I'm right with you. It's funny because when I became an entrepreneur, I became more structured, but in a way that was up to me. And so,
exactly,
like you said, like you like to work even more than probably most people. Any entrepreneur is that way, but you get to decide what that looks like and what you
so
work
true.
on, how long you work on it for, all that stuff. And you're so right, man. I mean, it really is just we're always going to be in the search of a problem. So overcoming the problem that you're currently dealing with, thinking that once that's over, everything's going to be fine and dandy. It's like no, there's another one, and we're always in the search for. And this leads me to a question that I'm curious of your perspective on. One thing that a great friend of mine told me, and I've really kind of realized took on this perspective as well, is I will always say that I don't get sick. Like
Mm,
I will tell everyone, I see people get sick day after day, week after week. People just get sick all the time. I don't know how you get sick. I don't get sick.
mm,
And it's kind of like the same perspective of like I'm a lucky person. Like I may not be the luckiest person in the world, but I'm gonna take on that belief because I'm gonna see more opportunities if I believe that. Same thing
mhm,
with I don't get sick. Like maybe I will get sick in the future for sure. We're all gonna get sick, but I don't get sick. And taking on that belief, I haven't got sick in years, and I think that that
mhm,
belief does really serve me. I know we talked a little bit placebo, nocebo,
mm.
but like, do you find that this is something that really does play a big role in people getting sick or injured or whatever it may be?
Yeah, I think the way you kind of, in a way, I think the way you frame life and some of those beliefs and the things you tell yourself, I think when you're thinking about them, you look for that in your
Yeah,
life and in your environment. You find those things, right? Like, because I think it kind of is like that pattern recognition that we're so good at as humans. Like, when you are, to me, when you're just thinking about, you're having positive thoughts about different things, about your health, about the thing you're working on. Like it's almost like that visualization that we talk a
yeah,
lot about, like putting something into the universe, like whether you verbalize it or you tell other people about it, you think about it. I think when you do that, you start to it gets you moving in that direction. But I think you also notice things in the environment. I think there are all these kind of things that happen. Maybe it draws other people to you because of the way you carry yourself or the things you're talking about or the energy that you bring to situations. I think it's a complex area, but I do think that kind of your beliefs and mindset kind of around your life, around your health, if you have that kind of framed in a positive way with gratitude, I think it does draw more of those things to you, partly because of the energy you put out, and I think because of the things you tend to pick up on in the environment. I think it's a really neat area, and I've heard a lot of people. For a while, I got really into kind of thinking about that idea of like visualizing things and talking about them, and how that can help to manifest those things in your life.
mm. Yeah. I Breaking the Habit of Being Yourself by Joe Dispenza is one of my favorite books I've ever read. I
Mhm,
recommend it to everyone, and it's a lot of that of the um almost imagining as though you're in the position you want to be and you're feeling that feeling, and then when you come into it in real life, it becomes more normal to you. And as every single person is trying to do, we're trying to avoid discomfort and unfamiliarity. So like if we were familiar to it, we'll move more towards it. So we're gonna get what we look for. It's really how life
mhm,
works. Like we talked about earlier. Like I said, headaches, chronic
mm.
back pain, I think are two common things that most people deal with throughout their life. and a lot of it can be led by belief, and say it is, and it has nothing to do with something that actually happened. How can we almost let go of that belief system and break through if we have so much evidence to reinforce it? I mean, I've had
Hmm.
headaches for at least once a week for probably my existence of life. How can I unlearn that or let go of that?
Yeah. Yeah, it's a great question because a lot of people do latch on these and it kind of becomes part of their identity, especially when there's been a family history of it or they've had it for a long period of time. People will, or maybe there's a tension that they receive
Yeah,
from having that issue, whatever it is, and it wraps into their identity. It can be hard for people to let go, to kind of dissociate from that issue. And I think, some of it, I think some of it is helping people kind of understand first, maybe just some of the evidence around these different things, like looking at the science of, some of the things we talked about before, just kind of the pain and injury science. I mean, for sure, some of these things do have genetic components. And so there are factors out there that can be, really can be evidence based to the way people feel. I think sometimes too, when it comes to something like persistent pain, the reality is that some people do have persistent pain conditions that it wouldn't be realistic for me to say that you can achieve 100% resolution of this problem. Sometimes
for
that
sure.
does happen, but for some people, like migraines and headaches are one of those examples where some people, whether it's kind of a genetic predisposition, or some other factor that we can't measure, some people have more of a tendency to struggle with that over their lifetime. And it would be inappropriate for me to tell someone, I have the fix for you that's going to 100% solve this. Because you see a lot of that stuff online. I don't even really like seeing that word fix with some of these conditions because it makes people believe that there is some just sort of easy one-off fix that's going to completely change their situation, erase their symptoms. And don't get me wrong, like sometimes that does happen for some people. Sometimes they find the right thing and it really does get rid of their symptoms. But there are a lot of people who struggle with chronic and persistent pain that like mental health issues. I talk about this a lot. My mom is a psychiatric nurse practitioner, and I've had different, I struggled with social anxiety for about 10 years, and it's still there, but it's probably 90% better than it used to be. And a lot of persistent and chronic pain conditions in the body are like this too, where you can learn coping strategies to help desensitize your system, and maybe your symptoms get 90% better. But it might be something you always have to think a little bit about managing, and it's always in the background just a little bit. Like maybe you are someone who has migraines or headaches, or you have low back pain, and it might be that you can really make a big dent in that. And like I say, maybe you can take it down 90%. But sometimes these kind of, we call them like pain recipes, or these kind of they're called neurosignatures in our nervous
Mhm.
system. We have these neurosignatures of patterns of neurons that fire together. And sometimes when you get a group of neurons that fire together and create something like low back pain or headaches, it can be hard to completely eliminate that kind of neurosignature. It's
Yeah.
that path has sort of been grooved, and you can really desensitize it, but to make it really go away, sometimes that part that part really can be challenging. So, I think it's a tricky one. I think it varies so much person to person. And sometimes this is where so much of physical therapy, the longer I've been in this, I tell people all the time, really is therapy, like kind of talk therapy,
Yeah.
especially when it comes to long-standing pain. If somebody has an ankle sprain, there's not as much talk therapy. It's a little more straightforward, and it's a mechanical thing that you are working on solving. But for more persistent, kind of complex pain disorders like chronic low back pain, chronic headache pain, some of those require they are a multifaceted experience that require a multifaceted approach. And so sometimes some of the best pain centers in the world, they do this. They have physical therapists, they have psychological counselors, they have like yoga instructors, they might have an MD who specializes in pain interventions like injections, cortisone injections, different things like that. So I think because there's such a big psychological aspect to this, kind of a revolving around your mindset and beliefs with persistent and chronic pain conditions, that having that person who specializes in how you think, that like a psychologist, someone like that can be such a big part. A lot of people have had trauma earlier in their life, and maybe that's influenced their nervous system in a way, and the pain is just the manifestation of that. And they could come to physical therapy over and over again, but maybe it's not until they actually go talk to a counselor and deal with some of that trauma that it actually gets better. So I think, if people are struggling with some sort of chronic condition and they're going down all the normal avenues of kind of like chiropractic, PT,
Mhm.
acupuncture, they're trying to incorporate exercise and movement and they're not changing. I think the next big part is really try to address your stress, your mental health, your thoughts and beliefs, any trauma that's there, because for a lot of people, that is the root of where their musculoskeletal symptoms are coming from.
Yeah, it's like we alluded to earlier, the way our nervous system feels and responds to the world plays such a massive role in the pain we feel in our life, and it's not talked about. Anything that we talked about in this entire podcast, I wasn't taught, you weren't taught. We like it it should be more given into the world. That's why I want to speak on it, because it's so important to understand the things that we just, if we have no awareness of them, then we can't look out for them. I have two more questions for you, and
Yeah,
I would love to have you on the show again. This was
heck
awesome. I
yeah.
feel like I can ask you a trillion more
We could
questions.
keep going.
Yeah, so we hear a lot in the world today of ice therapy, sauna, red light, walking 10,000 steps. Like, there's so many habits that people want to add into their life. Is there any that you look at and you think this isn't as important as people are giving enough emphasis to, if that makes sense?
Yeah, I think people focus too much on a lot of those kind of modalities. Like they
Yeah.
focus too much on I got to get a cold plunge and go do the sauna and I should get a red light and oh yeah, I mean some of these I just think they're like the icing on the cake.
Hmm.
So it's like supplements in the nutrition world. Like if
Yeah.
you're a nutrition, you should focus on like eating whole foods, getting all your macronutrients and
Hmm.
micronutrients in the appropriate levels. And then if you want to think about supplements after that, but people they want to go right to that like thing that's going to give them the instant
Shiny
change. And
object. Yep.
yeah, exactly. The pain, the physical body is a lot like this too. People are looking for this kind of they're often sometimes the modalities are kind of sexy and it's like people want to
Hmm.
go to those and they think, oh, this is going to be the thing that I really need to focus on. And really more of it is the 10,000 steps is a great one. Like just I noticed during COVID actually that I was, at home and just working on a computer and I wasn't moving as much. I wasn't going to the gym. The gyms were closed. I ended up just getting like a fitness tracker watch just so I could have like an objective piece of data each day on my steps. Yeah.
Yeah.
Like, dude, just
Yeah.
that's one of the best things you
Absolutely.
can do. Just get something to track steps and just try to get just we have research showing that the more steps you get, the better it is for your health. It's a predictor of mortality. Like just try to get more steps over time. Like if you're going to get 3,000, start there. Work up to 5. Try to get up to a goal of 8 to 10,000. Like that right there, just basic movement is
Mhm.
kind of like the nutrition side of just like getting your micronutrients and your macronutrients, like getting your protein, your carbohydrates, your fats, like whole foods. In the movement world, in the physical therapy, pain, injury world, it's kind of like just getting your daily dose of movement. Just don't be sedentary all day. And one of the easiest ways to do that is just going for walks. And so I think, and then probably outside of that, really the next thing that I'm talking that's so important for the musculoskeletal system is resistance training. And
Mhm.
resistance training is what most people think of as just strength training. It could be body weight related. It could be with, going to the gym and using machines or weights. If you're new to resistance training, machines are a great option because you don't have to worry as much about kind of the coordination and motor control of, like dumbbells and barbells. There's a little higher injury risk if you're new to those, but it could be things like push-ups, air squats we were talking about, just like it could be just doing lunges, just resistance training, strengthening your body. Even though the musculoskeletal system, the nervous system is more complex than a simple machine like a car, it does have a lot of mechanical kind of characteristics. And so when you think about your bones and your muscles and tendons having that mechanical nature, when you think about something like resistance training and strength training, it literally it makes those tissues more resilient. And if your musculoskeletal tissues are more resilient, you're less likely to have a fracture, you're less likely to strain a muscle, you're less likely to tear a tendon. The injury risk across the board drops, and resistance training has the best evidence, has better evidence than mobility and flexibility training, better
Yeah.
evidence than like balance and proprioceptive training. Like just if you're going to focus on something to keep your physical body healthy, try to just incorporate resistance training 3 to 4 days a week. And it could be short. It could be 20 to 30 minutes. It doesn't have to be a really long session.
Yeah, like I said earlier, when I was doing a lot of reps, didn't want to go, but I went to lower reps and I enjoy it so much more that my workouts are 30, 45 minutes, but I'm getting everything I need out of those workouts
Yep.
because I'm shooting for that more. And yeah, man, I mean, who would have thought that it's the things that are straightforward or the actual solutions, right? It's like just
Yeah.
walk more, eat foods that you know what's actually in it, like ingredients. Throw around some heavy weights. We want it to be more difficult because, like you alluded to earlier, our brain's always looking for problems. And so if
Mhm.
what we're doing isn't working, we automatically think it's something else. But we don't think about the small things that play the biggest role in what we're doing that isn't working. Because maybe it's not the thing itself, but it's the approach that you're taking. Maybe you're not consistent. There's so
People
many
want a
small
quick
things.
hack. Like so many people
Yeah.
want just this like quick hack, and a lot of these things take some consistency and discipline. But they're the things that are going to move the needle the most. Like getting your nutrition, like the amount of processed food and just added sugar and things that are in our Western diet. I mean, it takes discipline to eat healthy, and you have to learn to like read nutrition labels and figure out what you're putting in your body. The same is true of exercise. Like it's not going to just change overnight. Like you've got to be thinking about the nutrition side, getting the right amount of calories. So many people are hypercaloric. They're going to Starbucks and taking in 600 calories in a drink. And you know, those like the nutrition side, it takes a little while to dial it in and to see changes. The same is true of exercise. You've got to find the movement you enjoy, and then you've got to be consistent about it. Like it's not gonna your system really is amazing and how much it can adapt and change, but it does take some time. So you've got to figure out what works for you and that you enjoy so that you actually stick to it and be consistent.
Yeah, it's like a diet is the same thing for going to the gym for trying to do 6, 7 days a week when a diet doesn't work because it's not a lifestyle change.
Mhm.
People look at me and think that I'm on a diet because I, for the most part, about 90% of the time, eat whole foods. And that's if I know what's in it, I'll eat it. If I don't know what's in it, why am I going to eat it? And
Mhm.
people look at that as a diet because we're so down the rabbit hole of just eating so many processed foods that it's seen as a diet when you're eating actual foods. And it's mind-boggling to me, but
Mhm.
I mean that's the world that we live in today. And so just being more thoughtful of it. I mean, when I found out that like you said, how much sugar was in coffee. I used to think people that drank black coffee were like you had to be like a Navy SEAL or like something insane to drink it. And then I found out about how many calories were in, regular coffee. Overnight, I only drink black coffee now. And so
Mhm.
it's just such a massive shift. Once you see it, you can't unsee it. I mean, when I
For
first
sure.
started tracking calories, it's the same thing. I mean, you look at food in a completely different way. Same thing with the gym. I mean, it's a way of life, and finding a way to enjoy it, I think, is the only approach that you can take because we're trying to expand our health span, not just our lifespan, and that's the real
Mhm.
approach that we're trying to take.
Exactly. Yep, such a big component because this there's this idea of we used to talk about in one of my classes called compressed morbidity, and if you look at the data, most people live with 12 years of disease at the end of their
Yeah.
lifetime. And so it's just like you said, it's like that health span versus lifespan. It's one thing to live a lot of years, but if you live to be 90, but you had 12 years of disease, that's not great. So you really want the health span concept. You want to live with as many years as you can disease free. And that's where all these lifestyle, yeah, you have your genetics and you can't control that, but you have a ton of control over all these modifiable lifestyle risk factors like
Mhm.
movement and exercise, your nutrition, your sleep, trying to limit alcohol and tobacco use. Like those are some of the big like things you can work on. And so it, doing those, we have so much evidence showing that they call it compressed morbidity. So you're shrinking those years of disease at the end of your life by being consistent with these different strategies.
Yeah. Yeah. Man, this has been awesome. Such an amazing conversation. There's one last question I ask every guest. My question to you is, what belief are you currently unlearning?
Wow, it's a great one. I think actually, let's see. The biggest belief that I'm unlearning right now. Actually, for me, it's probably a business type belief. And it probably revolves around money.
Mm,
I grew up in a household where there was no kind of entrepreneurship. My parents weren't entrepreneurs, and my parents were they both were in fields social. My dad was a social worker, my mom's a psychiatric nurse. They really had hearts for serving other people. And I think I sort of grew up with the mindset that if you made money, it was bad in your profession. And so I came from sort of always a nonprofit almost mindset that And that is really how I thought a lot about what I did with rehab science, with everything I was doing on social media and everything I created for the longest time. I thought of it as a nonprofit and something that it'd be wrong for me to make money helping people with the content that I create. And so it's a belief I had to unlearn. I had to kind of change that relationship with how I viewed my work and making money from it. And now I really recognize, the more I've listened to podcasts and other entrepreneurs talk about this, that making money helps me help more people. Because when I make money doing this, because there was a period of time where I was spending a lot of time creating all this content and I wasn't making any money from it. And it made it, I hit a point where it's like, I don't know if I want to do that anymore, because I'm taking time away from my family, and it just, I'm not, I'm not, I'm not making any money doing this, and I know it's helping people, but it was becoming more challenging. There was kind of some friction there. And once I kind of changed that belief of, if I make money doing this, it will actually make it more likely that I keep going. It will help me produce better content, and that will reach more people and help people. And ultimately, that's always been my goal, is to help people on a large scale, to have kind of a worldwide impact. Because I think there are so many negative beliefs out there about pain and injury, and sort of false beliefs. And so that's always been my mission at the end of the day, was to help people kind of reframe pain and injury and help them figure out how to heal and overcome some of these things. And I really had to, like I say, kind of unlearn that belief that making money was bad, because really, if you believe what you're doing and you make money from doing that, it will allow you to create better services and products, to create better content, and that will just help more people and reach more people. So that's a belief I really had to kind of unlearn, really, in the last probably 2 or 3 years. It's been a little bit of a journey, but something I feel good about now.
Yeah, I'd say on the same side of that coin as well, because I resonate deeply with that. Is not only are you helping yourself help more people, you're helping them too, because people that pay attention. And if people aren't paying for it, they're not going to take it seriously. I realized that really early on. And I think it's really important to internalize that, because I mean, there's still days where you may feel like this just feels icky. It's not who I am. I want to help people that, and were probably in a similar position to me, that didn't have money, but it's a really empowering when people take on more than they can handle, or they invest into something. They're investing into themselves and they take it way more seriously. So so powerful. So powerful. This
Yeah.
conversation was awesome, man. All of your links and everything will, of course, be in the show notes. Thank you so much for taking the time to speak with me.
Thanks, James. Thanks for having me on, man.